Medical experts are worried about an aggressive move by HHS Secretary Robert F. Kennedy Jr. that could completely reshape the country's vaccine policy. The secretary, writing in a Wall Street Journal op-ed, announced that he's removing all 17 members of the CDC's Advisory Committee on Immunization Practices. That is an independent panel which consists of medical and public health experts who make recommendations to the CDC about who should get certain vaccines and when, including childhood vaccinations. Joining us now, infectious diseases physician and director of Boston University's Center of Emerging Infectious Diseases, Dr. Naheed Bhadelia, and Tim Miller is back with us one more time. Welcome to you, Dr. Bhadelia. So starting with you, because the secretary writes, quote, "The committee has been plagued with persistent conflicts of interest and has become a little more than a rubber stamp for any vaccine." What is your reaction to that, and what can you tell us about the vetting that these members undergo?
ACIP's been around for over 61 years, and they already have a process that evaluates conflict of interest and invested financial investments that may affect right decisions. What's really concerning here is that the secretary is conflating expertise in vaccine science and in medicine and public health as a conflict of interest. So the idea that you may be pro-vaccine, the idea of vaccines, is a conflict of interest. So the concern, of course, is that he is a lifelong anti-vax supporter for sentiments, and he's going to stack now the ACIP, if it continues to exist, with people who are against the idea of vaccination, which has saved over 150 million people globally. How can you be anybody in science or in the public or general public and be against the idea of vaccines and serve on a committee like this?
Well, let me take it further, because there's an infectious diseases expert, doctor, who calls this manufactured chaos. I mean, what kind of impact is this going to have for everyday Americans just trying to get themselves and their kids vaccinated against any different kind of disease we have out there?
Yeah, the ACIP, when ACIP decides what vaccine and who should get it, this is the use that, insurance companies then take to then cover vaccines, right? Mm-hmm. So right now, this kind of chaos does two things. It erodes trust in vaccines, which I would suppose is one of the goals. The second is if ACIP is now stacked with anti-vax champions, then if it doesn't support childhood vaccinations and things that have decades of research and safety information, then if insurance don't cover it, it kind of limits Americans' access to these vaccines in the long term. And that's my biggest concern. Is this a pathway to limit the access of Americans to vaccines? One more step. Let's go next further. If most Americans can't afford vaccines because their insurance companies can't cover it, how long until our school requirements with childhood vaccinations still stay in place if it becomes out of reach for most Americans to get vaccinated? You're going to see infectious diseases outbreaks. People are going to get sicker. Hospitalization rates will go up with diseases that are preventable. And I hope that there is leadership on the insurance company's side to say, look, the cost of those is a lot more than actually just making vaccines available to the public.
And this is a conversation that's been out there in the ethos the last 10 days or so, with having taken away the recommendation for COVID vaccines for either healthy children or healthy pregnant women. So, Tim, RFK Jr. made a commitment to Louisiana Senator Bill Cassidy. It was back in February. It was during his confirmation hearing that he would maintain ACIP without changes. So clearly, he has failed to live up to his word. He's done precisely what he said he would not do. The senator now says he will continue to talk with the health secretary to ensure that ACIP will not be filled with vaccine skeptics, which would potentially reflect RFK Jr.'s own personal theories. Is there anything Republicans could do or be willing to do about this?
Well, sure. I mean, you could go back in time and they could have stood up to RFK, which many people were asking Bill Cassidy to do, which Bill Cassidy acted like he was considering deeply. This is my home state senator. There was a lot of discussion about this down here in Louisiana. He's a doctor. He is a longtime advocate for vaccines. And he got this supposed commitment from RFK, and then RFK pulled the rug out from under him. And so you would think that at some point, like these senators, these Republican senators would have some dignity. And this is not the only case of this. Pete Hegseth, you might remember, promised to Joni Ernst that there would be like kind of a sexual assault czar at the Department of Defense. Maybe that's happened under the radar. We did some reporting at the Bulwark looking at this, and there's no evidence that that has happened yet. So there's several of these different cases where these guys told Republican senators something, promised them something in order to get their confirmation, and then they haven't followed through. So look, and Republican senators who are on these committees could do oversight. I mean, they could work with their Democratic colleagues and do oversight and put pressure, on HHS. And you would hope that Bill Cassidy, having been lied to about this, might be willing to work with some of his Democratic colleagues to be more aggressive in doing oversight over the administration, particularly on the vaccine issue.
I guess we will see if that happens. So for now, Dr. Naheed Bhadelia, thank you so much. Tim Miller, now I'm going to thank you. Thank you for staying with me for the entire hour with all your sage points on different topics.